Good afternoon, everyone. Thank you for joining us today to discuss locating eligibility information on the secured portal. My name is Karen Curtis, and I'm a provider outreach and education specialist here at WPS. Today, I am joined by my good friend Aline. Aline is going to be monitoring the chat for questions, as well as providing you with some additional information and links. We have just a little bit of housekeeping before we get started here today. First, if you haven't downloaded a copy of today's presentation and you would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center, along with a list of our upcoming events. Aline will also add a link in the chat so that you can get there quickly. Our training center also contains a web page for our encore presentations. Videos are available for up to 90 days and can be watched on our webpage without having to go to YouTube. We know that some of you may not be able to access YouTube from your company computer, and we want you to be able to receive the education that interests you. Each encore is posted with a link that will allow you to download a copy of the presentation. You will also be given another chance to complete a survey and provide your feedback. Today's presentation is being recorded, and if there are no technical issues, this will be posted to our website probably within the next week. Now, later, there will be a question and answer session if time permits. If you have questions related to today's topic, please send those using the chat feature. If there are any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience, and we want to know how we're doing. So later in this presentation, you will be given the opportunity to fill out a survey. This is your chance to let us know what we're doing right. Let us know if you feel that there are areas where we can improve, and it also allows you to give us input on what education that you would like to see in the future. And while this is a CMS survey, WPS looks at our results and we do our best to make the improvements that you ask for. This is a copy of our disclaimer. CMS does prohibit the recording of this webinar, and we are recording it to post it as an encore presentation, so it will be available on our YouTube channel and on the WPS webpage. So on October 12th, WPS made updates to the secured section of the portal. We held a webinar on October 29th that was an overview of the changes that were made. And today we're going to focus on the eligibility screens and what information they provide. Some of you may have heard that CMS issued CR 13754, which has directed MACs to disable the eligibility portion of their interactive voice response system, or IVR. That is being done to help protect beneficiaries from Medicare fraud. At this point in time, it is a pilot, so we will wait for CMS to give the final determination on whether or not the option will be removed entirely. The CR gave MACs until the end of March of 2025 to disable the eligibility function. WPS has made the decision to disable that function on January 1st of 2025. Now, there are other options for obtaining eligibility. The secure portal, which we will cover today, direct data entry, or DDE, for providers who use the FIS system, and the HIPAA eligibility transaction system known as HETS. There is a link on this slide in case you would like to get more information on that change request. The information that's being presented today can only be viewed by individuals who have registered with WPS. Because the portal contains protected health information and personally identifiable information, we must do our best to make sure that this data is only accessed by those who are entitled to have it. For those of you who may not have registered for the portal, I want to make sure that you know how. When you visit the WPS website, there will be a login in box near the top of the home page. You can click on the register link, and after accepting the terms of use, you will be asked to enter your MPI, PTAN, and tax identification number. If the NPI has fewer than 5 administrators, you will be given the option to register as an NPI administrator. Now, before taking on this role, you will probably want to review the section of the portal user manual, which is titled NPI Administrator Responsibilities. Those who become NPI administrators are responsible for other users under their NPI. They approve or deny access requests. They keep track of users' recertification dates and notify users when recertification is due. And they reset passwords, and that's just a few of the duties that they handle. Those who are not NPI administrators can have either standard or eligibility access. Now, standard users have access to all non-administrative functions. So this means that they can access the same functions as the NPI administrator, but they do not have the ability to manage other users' accounts. Eligibility users will only have access to the eligibility check, MBI lookup, and customer service inquiry function. This shows the information required to access the eligibility check section of the portal. If the service location field is not automatically populated, you will need to enter your facility or group MPI. Next, you will enter the patient's Medicare number, first name or date of birth, last name, suffix if applicable, and the starting and end dates. Now, the information that's provided is going to be based on the starting and end dates that you enter. And by changing these dates, you can search for information up to 4 years in the past or 4 months into the future. If you do not have the patient's Medicare number, the portal does have an MBI lookup. To use this option, you will need to have the beneficiary's Social Security number, first and last name, along with suffix, if applicable, and their date of birth. If the information entered is correct, the patient's MBI will be provided, and you will be given the option to jump to the eligibility check screen, which will display information based on the current date. Now, once you enter the information, and if it's all correct, there's going to be 2 options that are going to be available. You can either choose eligibility or you can choose supplemental insurance. I would like to give you some additional information on the supplemental insurance option. This information is for informational purposes only and may not provide a comprehensive list. The reason is because the information provided is limited to companies who have signed a trading partner agreement with Medicare. If Medicare has a trading partner agreement, then we are allowed to send claim information to the supplemental insurance company. Beneficiaries may have a supplemental insurance who does not have this agreement with Medicare, which would require you, the provider, to file a claim directly with that insurance company. Now, for this reason, you will always want to ask the beneficiary if they have an insurance that pays after Medicare. Information that can be found on the Supplemental Insurance tab includes the insurer's name and address, effective and termination dates, and the Coordination of Benefits Agreement number. Now, here's a view of all of the information that is available in our eligibility checks. These tabs will remain at the top of the screen regardless of what tab you are viewing. And if you are a Medicare Diabetes Prevention Program supplier, then the eligibility information available will be limited to information needed to bill for the MDPP services. And this is going to include the Part B eligibility dates, managed care data, Medicare secondary payer information, and end-stage renal disease data. The boxes that are outlined in blue indicate that there is information available, and boxes outlined in gray would mean that there is no eligibility information found in these categories. The first tab will be the summary of entitlement and benefits. Part A information is first, and it includes the entitlement date and the reason the patient is entitled to Medicare. In the entitlement reason code field, for this example, it's blank, but you can see it's got a little circle with an I in it. If you hover your mouse, if there's a code there, and if you hover your mouse over the code, then a definition will be displayed. There'll be a better example to show you on the next slide. If the beneficiary had any periods of time that they were eligible for Medicare during your search parameters, those dates would also show. Now, I have been told by a couple providers that they were having some problems with eligibility dates not showing, and I contacted somebody on the portal team and they were able to recreate that. And last I was told that they were looking for a fix for that issue. I have not found it out on the website listed as system issue, so I'm assuming it's been fixed, but I just wanted to make you aware of that. Now, as we move down the screen, you will see the lifetime reserve days, if any days are remaining, and you'll notice that lifetime psychiatric days are also included in this list. Next, we have the hospital base and co-payment days. Lastly, SNF days and co-payment amounts are listed. And you'll also notice that the 2024 co-payment amounts are shown in their respective rows. So you have the amounts for each of these when days are used. As you move down the summary page, you're going to find the Part B entitlement information. This also has an effective date and an entitlement reason code. So this example, it has a 0. Now, I don't have access to the portal, so I don't know what that means. But again, if you hover over it, it would give you a definition. Now, remember that the Part B entitlement date can be different from the Part A date, since Part B is voluntary and requires a monthly premium. This section provides information on available benefits for pulmonary, cardiac, and intensive cardiac rehabilitation, along with smoking cessation. Blood deductible information can be found here. And although there are separate tabs for Medicare Advantage known as Part C and the Medicare Prescription Drug Program, also called Part D, you can find entitlement dates listed here on the Summary tab. Here, there is a separate tab for the Part A and Part B deductible. The Part A deductible starts out with the year that the information is for. The Part A deductible amount is shown here in the base field, and there's a field to show the amount remaining to be met. This screen would also show any hospital stays and would include the billing provider's NPI, along with the date of earliest and latest billing. The Part B deductible tab shows the coverage year, deductible amount for the year, and any amount that would be left to pay. The ESRD tab would provide eligibility information for beneficiaries who are eligible for Medicare due to end-stage renal disease. You can determine when a patient's coverage started as well as when dialysis started. If a patient is entitled to Medicare only because of ESRD, then coverage is going to end 12 months after dialysis treatments end or 36 months after a kidney transplant. Here on the home health screen, you can find start and end dates along with dates of earliest and latest billing. The home health agency's NPI will be listed along with the contractor's name and number. The patient status code is also provided along with the NOA indicator. For the Preventive Services tab, I am only showing a portion of what you can see on this tab because there was just way too much information to try to include on one slide. Here you can find information about preventative services that are subject to frequency limitations. So things such as annual wellness visits, diabetes screenings, and mammograms. The procedure code will be listed along with the next eligibility date. Many of the preventive services are provided without deductible or coinsurance being applied, but there are some where that can be charged. You'll also see a column titled Modifier. In the examples shown here, you can see modifier 26 for professional component, but this column can also contain modifier TC for the technical component. In some cases, the professional component may have a different next eligibility date than the technical component. So that'd be something that you'd want to pay attention to if you see that. Information displayed is current eligibility data, and you won't ever want to infer that services were provided in the past. So for example, patients can receive an annual wellness visit annually, but just because the screen shows a next eligibility date of 1/1/25, you don't want to assume that they received the annual wellness visit in February of this year. At the very bottom of the Preventative Services tab, you will find the patient's vaccination history. This section will show the procedure code, immunization date, and rendering providers MPI for pneumococcal, influenza, and COVID vaccinations. If the patient is enrolled in Medicare Part D prescription drug plan, you will find information on the PDP tab. This section will list enrollment and termination dates, contract and plan numbers, along with the Part D username, address, phone number, website if available, and plan name. Remember that although these prescription drug plans are referred to as Medicare Part D, these plans are offered by private insurers. So if you have any questions related to a patient's plan, then you're going to have to contact the provider listed on this screen. The Therapy Caps tab provides information regarding the beneficiary's therapy service threshold. Now, prior to 2018, there were financial caps put on therapy services, but the Bipartisan Budget Act changed this so that beneficiaries could receive the care they needed. These are now referred to as therapy thresholds or KX modifier thresholds. This tab lists the type of therapy, deductible year, and amount applied towards the threshold. Now, although only occupational and physical therapy are listed, speech language pathology services are included in the physical therapy cap. The Medicare Diabetes Prevention Program tab provides information as to whether or not the beneficiary is participating in this once-in-a-lifetime benefit. You can find effective and termination dates for coverage, HCPCS for services that have been billed along with the date the service was provided, and the billing provider MPI. At the top left, right here, you will see a period to end date. So the NDPP program originally offered an optional second 12-month period of maintenance sessions, but that was eliminated in 2022. So you shouldn't see information there if the beneficiary recently got on the MDPP program. Additional coverage is for reporting data related to acupuncture as well as cognitive assessment and care plan. This screenshot shows that the beneficiary has remaining technical sessions available along with the next technical date. There are also professional sessions remaining and the next professional date. If a patient shows signs of cognitive impairment during a routine visit, Medicare offers a separate visit to provide a more detailed assessment of the patient's cognitive function and develop a plan of care. If the beneficiary received this service, you would see HCPCS 99483 along with the date of service and the rendering provider's NPI. The Medicare Secondary Payer tab will list insurance plans that pay before Medicare. This tab will provide the earliest and latest effective dates. The insurer name will be listed along with a code description, policy and group numbers. If there are any diagnosis codes that are associated with the patient's accident or injury, then those would be shown. Additional information includes patient relationship code, last maintenance date, MSP source, and an ORM indicator. The MA tab will show information regarding insurance that will pay instead of Medicare. These policies are also referred to as Medicare HMOs, Medicare Part C, or Medicare replacement plans. Here you will find enrollment and termination dates for the Medicare Advantage plan, contact and plan information, along with the insurance provider's name and address. You'll also find the plan name, enrollment type, and bill option code. If a beneficiary elects to receive hospice care, they agree to receive palliative care instead of treatment to cure the terminal illness. Information shown here will include the benefit provider ID, hospice start dates, receipt date, revocation date, as well as a revocation indicator. The next tab is the QMB entitlement. A QMB beneficiary is one that is eligible for both Medicare and Medicaid. These beneficiaries may not be billed for Medicare deductibles, coinsurance, or copays, but you may be eligible to bill the state Medicaid program for these costs. You can see that this screen looks a lot like the information found on the Summary tab. In the top center, you will find the QMB enrollment period. QMB eligibility is determined monthly by the state Medicaid office. The enrollment information is entered by the Medicaid agency. So Medicare cannot guarantee that this information will be updated at the first of the month. Now, the last tab I want to discuss today is the Part B immunosuppressant drug tab. And I apologize for not having a screenshot, but I still wanted to provide you with what information can be found here. Patients who currently have or previously had Medicare because of ESRD may be eligible. This benefit covers immunosuppressive drugs, which are medically necessary for preventing or treating the rejection of a transplant organ or tissue. If a beneficiary has this benefit, then information that would be provided in the tab is going to include the enrollment reason code, coverage dates, deductible base and remaining amounts, and coinsurance. Now, I want to remind everybody again, since the IVR is no longer going to provide eligibility, there are other options if you are looking for patient eligibility. If you're a provider that bills using the Fiscal Intermediary Standard System known as FIS, then direct data entry or DDE is another option that could be used. DDE has up to 16 screens available with beneficiary entitlement information. The HIPAA Eligibility Transaction System, or HETS, is available for both Part A and Part B providers. This option involves submitting files via electronic data interchange, so a trading partner agreement is required. Now, I provided some resources which I hope can help you with the options you choose. You'll see that there's the WPS portal user manual, and that will give you information on how to get registered with the portal if you haven't done so. It also, like I said, gives the responsibilities for MPI administrators if that's something you choose to do. The next resource is the MPI Administrator Search. So if you aren't an MPI administrator and you're having issues, you can go out there and search and find out who the administrator is for your facility or for your group, and they could provide some assistance if you need it. Direct data entry, I've provided a link to the overview on the WPS website. And then lastly, we have a resource on how to get connected with HETS if you have not already done so. Now, that's all I had for material that I wanted to present today. So I want to turn it over and ask Aline if we've had any questions come through the chat.
Hi, Karen. Thanks for all of that great information. I know I learned a few things too. And as of right now, we do not have any questions in the chat.
Okay, thank you for checking. We will go ahead and move on. Now, this slide is not in your handout, but we would like to let you know and invite you to join the Centers for Medicare and Medicaid Services Chicago Local Engagement and Administration for a special event for our providers. The CMS Chicago LEA is going to host a Medicare open enrollment event on November 15th at 1:30 p.m. Central Time. You can attend in person at the CMS office or virtually via Zoom. This is a 60-minute event, and it is designed to keep you up to date on information that's important to you and your patients. Each year, Medicare offers a Medicare open enrollment period from October 15th through December 7th. And during this time, your Medicare patients are encouraged to review their current Medicare health plan coverage. This event will help you understand the Medicare open enrollment process and the resources available to assist your patients in their health plan coverage decisions. So who should attend? Facility or group private healthcare providers, nurses, registration personnel, discharge planners, social workers, and any other support staff that assist you with your patients. Registration is required. We will put the registration link in the chat, or you can go to our live events page. Now, please note, if you are going to attend in person, you'll need to register by November 11th. And in order to receive the webinar information in a timely manner, please register 24 hours in advance if you're going to do that virtually. This session is for CMS Chicago Regional Partners located in or serving customers in Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. Now, if you're located outside of these states and would like assistance in connecting with your local CMS office, we're also going to add a link to that webpage in the chat. After the close of today's webinar, you should receive a thank you for attending email. This is where you're going to find your proof of attendance and contact hours for continuing education units. This email will also contain a link that gives you another opportunity to provide feedback to WPS. If you don't get this email, please check your spam or junk folder, and you're going to want to add the messenger@webex.com to your safe sender list. I will say that if you joined only by phone, you will not receive this email. So please send an email to wps.gha.education@wpsic.com and include your name and the phone number that you used to join, so that way we can check our records and get a certificate sent out to you if you need it. If you think of any questions after the webinar, you have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject so that the staff will know that your question is related to this webinar, and they'll send it directly to me. Remember, if your question is claim specific, then those would need to go to customer service. When you disconnect from the webinar, you're going to be redirected to a CMS survey. I'm also having Elaine added a link in the chat. Your feedback really does mean a lot to us, and we review what you have to say, and we do our best to make the changes that you ask for. This is also an opportunity for you to let us know what topics you would like to see us provide education on in the future. So if you would be specific, that would be great. Also, if you have ideas that you think would improve how you receive your education, be sure to let us know that also. The redirect looks like what you see here on the bottom right, and we just want to show you a picture of it. We don't have control of how this looks, so we just want you to know this isn't spam or anything malicious. Now, this brings us to the end of today's presentation. On behalf of myself, Elaine, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.